Hello, my darlings, and welcome back to Talk with Chi, powered by FLORAX Pharmacy. My name is Chinonto Onigbula. I am a pharmacist and the managing director of FLORAX Pharmacy and Stores located here in Lagos, Nigeria. I know in Africa and especially Nigeria, we are not the best to go to the hospital for like a random or a routine checkup, except we have broken down or have fallen ill on or already experiencing some symptoms for an illness. But I would want us to think about our bodies like this. Think about your body as as a machine or as a car. You wouldn't want to wait for a car or your car to break down before you take it into the mechanic's shop for an oil change or to service it, right? So that's how I would want us to see our body as a very expensive machine, especially if you drive an expensive car. You know what it is to take care of that car, and you wouldn't want it, to break down or start having serious issues before you take it into the mechanic shop. Your body is even more than that, it's even better than that more expensive car. And I don't think we should wait till we start seeing symptoms or till we break down before we take very good care of our bodies, right? So I know you might see this video and say, oh, it's probably not for me, but I would want you to answer this question. Are you sexually active? Did you have more than two partners in the last year? Do you have family history of any illness? That is, do you know of your uncle or auntie or mother or father or grandparents to have any of this illness? If your answer was yes, then this video is for you. Not only that, this video is for your family or your loved ones or your friends or your colleagues that you love, and I think that you should share this video with them just so that they can learn a thing or two from this video. So without wasting more of your time, let's jump right into this video. So I wanted to actually make this a female topic, but I was like, no, this channel is not only for females, it is it's for both sexes, right? And so I just added the test together. So if you're a woman, some tests will apply to you, and if you're a man, some tests will apply to you. Some tests also should be done more frequently than the others, right? So why do we advise you to do a regular screening or regular checkup? It's because the probability of the doctor catching an illness at its early stage is better. And of course, you know that if an illness is caught in the early stage, the probability of the doctor being able or you being able to fight that illness better and also improve your quality of life is better. Unlike when you catch an illness at its late stage, when really there's nothing much that the doctor can do. They'll probably just tell you, it's in its last stage, a fourth stage or whatever. You probably just have a few months, enjoy the few months with your family or not. So I would say regular screening would help to improve quality of life, help to prevent complications, help to prevent a case of, oh, I wish I had known, and stuff like that. The first test I would like to talk about is the blood pressure test, right? If you are of African race or African American descent, if you are obese, right? If you over the age of 40, right? If you have family history, meaning your father or your mother or your grandparents, someone in your family that has heart problems or heart related problems, I would advise that you do this test even more frequently than once in 3 months. I would say if you're over 40 and all of these risk factors are you have all of these risk factors, you should do this every day. There's the manual way to test this, where they use the stethoscope and the fig, and they a health personnel would check your blood pressure for you. But life has become so easy that there are automatic machines. I don't know if you can see this. There are automatic blood pressure machines that you can just put on your arm or on your wrist or wherever you're supposed to put it on, and it's just by the click of a button you can measure your blood pressure. The best time I would say to measure it with an automatic machine would be in the morning when you just woke up. You've not thought about the stress of the day. You've not walked, stood up and started, going about your daily activities. I think that's the best time to test your blood pressure, right, in the morning. So values above 120 for your systole and 80 for your diastole. So they actually, the measurements are, two numbers. One is the up number, which is your systole, your bottom number, which is diastole. If it's above 120 and above 80, if this is a persistent and continuous elevated range, we would now say we'll check if you have hypertension. But I've seen a lot of people that are even in their early 20s that are already on blood pressure medications because they are already known hypertensive patients. So most of people will see this video and say, oh, God forbid is not my portion. There's nothing that God will forbid. If you do not take care of yourself, then your body will break down, and that is the truth. So I feel like if you do regular screenings of this and you catch this on time, then you'll be able to live a better life. So the next test want to talk about is your cholesterol test. I feel like cholesterol test and your blood pressure test, they do go hand in hand. And I think if you are of age 20 and above, I think you should do this once, at least once every 3 months, right? And if you have risk factors like you are obese, you have and somebody in your family history, has any heart related illness, your somebody is a known hypertensive patient, because I said they both go hand in hand. Somebody is a known hypertensive patient, someone is obese, that person is obese. Those are risk factors, and if you fall in any of that, I think you should even do it more, than once in every 3 months. The test is pretty easy. Your blood is drawn, and the machine usually calculates your total glycerides, your HDLs, which is your high density lipoproteins, which are good cholesterols, your low density LDL, which are low density lipoproteins, which are the bad lipoproteins. So obviously what we are trying to look for when we test for your cholesterol is to make sure that your good cholesterol, which is the HDL, are more than your bad cholesterol, which are the LDLs, right? To also test for your total cholesterol, obviously values below 200 milligram per dl are considered good values, right? And anything above that are suspicious, or will suspect high cholesterol, right, in your blood. So the next test I would like to talk about is your blood sugar or your blood glucose test. I feel like these three, your blood pressure, your cholesterol, and your blood sugar actually go, together. I feel like if you are above 20, you have a family history of diabetes, somebody in your family that already is an already known diabetic, right? You are obese, right? You should do this test, I would say, every month, right? And it's pretty easy to do it. You usually can do it with a machine called a glucometer, right? So it usually comes something like this, and like a lancet, you put the needle inside and it pricks your skin, a blood comes out, you put it in a strip. I don't think I have a strip with me. You put it in a strip, and then you insert the strip into the machine. The machine reads the strip and tells you what your blood glucose values are. I would say that the best time to take that blood sugar test obviously is in the morning when you have not eaten. So there are two values, right? That's what we call the fasting blood sugar and what we call the random blood sugar. So fasting blood sugar, like the name says, that you are fasting, your body is fasting, it means you have not eaten, right? And then random blood sugar means that you have eaten, right? And you must have had food. But I think even for the fasting blood sugar, it's best to do it as early as possible, because if someone comes in to do a fasting blood sugar at about 12 noon, I would generally categorize that as um random blood sugar, because your body obviously would have started doing some release of sugar, or yeah, glucose stored in your body, and also that might not necessarily be a fasting blood sugar. For a good blood glucose test will be for fasting, right? It will be values up to of about 100 milligram per dl, right? 100 milligram per dl for fasting blood sugar are considered to be good values, but anything above that for fasting blood sugar, will be suspicious of diabetes, right? Another test I would want to talk about is your Pap smear, right? So this will pertain to women. Pap smear is a test that is used to check if there are abnormal cells, in your cervix, right? So you go into the hospital and the lab, and you're told to lie down, and then a speculum is put into your vagina just to help to increase or widen the vaginal canal, just that a brush can be put in. It's like a little brush to scrape some surface of your cervix, just so that that sample is looked under the microscope to check that there are no abnormal cancerous cell in the cervix. So this test will help to prevent, or help to test if you have cervical cancer. You know, this test along can be combined with the HPV test, which is another risk factor for having cervical cancer, right? So I'll talk about HPV in probably another topic or another video, because it's a very broad, right, topic. So just know that pap you should do your pap smear every year, or at least once in 2 years, for women that have a risk factor, or maybe you have family history of cervical cancer, right? Or you have you have the HPV virus, you are sexually active, you have multiple sex partners. I would advise you do your HPV or your pap smear regularly. The next test I would say is the prostate test, or the prostate scan test. This will pertain to men, right? So I would say for a prostate test, if you have a family history of prostate cancer in your family, I would say once you turn 40, you should do this every year, right? um yes, once you turn 40, you should do this early, even if you don't have family even if you don't have a known family history of prostate cancer. I'll say do this every 1 in 3 to 5 years, right? There are two ways of testing for a prostate cancer, right? So the first one will be the digital rectal examination, where I think most most African men do not like. That's where the doctor can actually decide to do it do it himself by putting his hand through his rectum to try and feel for the size or the shape or the texture of his prostate gland, or your prostate gland if you are a man. Another way is the PSA test, that's the prostate specific antigen test, where your blood sample is drawn, and to check if the prostate antigens are high, right? If the values are high, then they would suspect that it might be prostate cancer. The next test I would like to talk about is a mammogram, right? A mammogram is a test where your breast, as a woman, your breast um is x-rayed, right? Rather, right, your breast is x-rayed and is checked. They're checked for lumps, or cancerous growth, right? Or funny bumps. If you have a family history of breast cancer, I would say, and you are probably over 30, I would say do this every one do this test 1 in 2 years. I would say if you're over 40, do this every year, right? Breast cancer is no joke. Breast cancer is no joke, right? If you like I said, if you are over 30, if you're over 40, do this every 1 or in every 2 years, right? This breast a you should get a mammogram. It's just an x-ray scan of your breast, right? And the x-ray will be able to see even very small, abnormalities or small cancerous cells, that even by doing the breast scan breast test, right, where you massage around your breast, it will be able to find, even those very little cells. So if they catch it on time, it is better for them to catch it on time, basically, right? So if you know you have a family history of breast cancer, I'd advise you get your mammogram as regular as you can. The next test I would like to talk about is the glaucoma test. Did you know that glaucoma is probably the number one cause of blindness? Yes, it is. Glaucoma is no joke. The bad thing about glaucoma is once your optic nerve cells are damaged, it cannot be reversed. There is no drug or eye drop that you can put in your eyes that can reverse the damage of your optic nerve. What is glaucoma? Glaucoma is the persistent increase of pressure in your eyes. So by the time the pressure is by the time there's high pressure in your eye, it would affect your optic nerve, and this optic nerve is what sends signal to your brain to tell you, I am looking at the camera, or I am looking at white, or I am looking at black, right? So once there is damage to that optic nerve, there cannot be a signals cannot be sent to your brain to say, oh, this is what I am seeing, or this is not what I am seeing. So glaucoma is no joke. If you have a family history of glaucoma, you know that, oh, your grandma had glaucoma and was blind, or your dad has glaucoma, or your mom has glaucoma, or your uncle has glaucoma, I would say that you should do an eye test every year. Do an eye test every year. Once you are above 20, do an eye test every year. So other risk factors for glaucoma would be, if you are African or African American descent, if you are Hispanic, if you have high blood pressure, or a family or someone in your family that has high blood pressure, also family history of someone that has glaucoma, like I have said. I would, if I'm above 20, I would do an eye test every year. So there, if you are doing a glaucoma test, I think there are about 5 types of a comprehensive test would consist of like 5 types of tests, but I will really take three, like, very importantly. That is the tonometry, right, to test the pressure or check the pressure of your eye. Number two will be the ophthalmoscopy test. The ophthalmoscopy test is basically just checking, the shape and color of your optic nerve. Number three will be your field of vision test, right? Your field of vision test. So those three are really, 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 really important when you are testing for glaucoma. So if you do this every year, you would be able to detect if you have glaucoma on time. And the bad thing about glaucoma, I would add, is that sometimes you would not notice the damage until your eyes are irreversibly damaged, until the optic nerve is very, you will not see any symptoms. So you could be able to drive today, and tomorrow you could go blind. That is why glaucoma is so bad, because you probably not see any blurry or visional symptoms, and then the next day glaucoma creeps up on you. So please, if you have any of these risk factors I've talked about or spoken about, please get tested as soon as possible and get tested regularly. The last and final test I want to talk about is your how do I put it? I think I would just say a sexual like an STI profile or STD profile. So that would encompass or consist of HIV, HPV, syphilis, gonorrhea, and chlamydia test, right? I would say HIV, HPV, syphilis, gonorrhea, and chlamydia test. I'm gonna just put them in one test, because I feel like if you're testing for gonorrhea, you might as well test for syphilis, or because they are all STI, they are all sexually transmitted tests, or diseases rather, or infections. And if you're testing for one, you test for the other. If you have multiple sex partners, if you are sexually active, and when I say multiple sex partners, if you had more than two partners last year, right? You have multiple sex partners, and you should get tested for that as soon as possible and regularly. If you know that's what you're going to be doing, you should get tested for that regularly. I would say for the HIV test, there's something called the window period, which is about 3 months. When I say window period, so it means that from when you probably contacted the HIV to when the HIV can start to show in your body, meaning from when your body will probably have or develop an immune response or an antibody response, will take about 3 months, which is called the window period. And sometimes if you do a test in that period, it might show a false negative, right? So the test might say, oh, you don't have HIV, but you have HIV. So I'll say, if you do it, if you are doing an HIV test, do it every 3 months, right? So yeah, so if for an HIV test, you can do it more than once in a year if you have several or multiple sex partners. I think that is about it. I think that is about it. But my mind keeps telling me that I'll probably do an updated video of this. Right now, those are the very important ones that my mind can think of, and I think everybody should be screened or tested for. If you notice, I was always saying family history, or multiple sex partners, or sexually active. Please take those keywords very importantly, right? Please take those keywords very, very importantly. Yes, if you like this video, please give me a thumbs up. If you have any question, you can send me a comment. If you have any private question, I would put up my Instagram handle, so you can shoot me a DM, right? So you can send me a DM, and I will try my best to get back to you. If you have any topic that you would think you want me to talk about, please write it down in the comment section. I would love to get onto it, right? I would love to do, just that. If you haven't subscribed to my channel, please click the subscribe button. Please like my video, just to encourage me that I am doing a good job. I would really, 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 really appreciate it. Share this video to your loved ones. If you care about somebody, you should share this video, right? I love you. See you in my next video. Mwah.